Hello, everybody, and welcome to McGuireWoods webinar on the OSHA Emergency Temporary Standard for COVID-19 vaccination and testing. This is Rod Satterwhite. I'm coming to you from our Richmond, Virginia office, and I am joined by my colleagues Brian Barger in Charlotte, North Carolina, and Micah Schwartz in Charlottesville, Virginia. Before we start, I've got a couple of housekeeping items that I want to go over. First, there is a resources icon on your screen that includes access to a copy of our presentation materials. You can download those anytime you want. Second, although you will see a Q&A feature, and I know some of you have already started to use that feature, unfortunately, given the size of the topic and the volume of information that we're going to try to knock out in an hour, we will not be able to get to questions during the presentation. You can feel free, however, to reach out to me, Brian, or Micah, or anybody else that you are in contact with at McGuireWoods with any questions. And also, later this week, we will be publishing another more comprehensive client alert that answers a number of the questions that we've been getting on the ETS over the last week. So last issue is we will be recording this presentation, and we'll be sending you a link to that recording along with another copy of the materials. Feel free to use them, share them, do whatever you want. And since we have so much to cover, we're going to go ahead and dive right in. So you may recall that about 2 months ago, President Biden announced his path out of the pandemic. And that announcement included a number of broad regulatory strokes, essentially in an effort to get people to get vaccinated, get the COVID-19 vaccine. And when I say broad strokes, I really mean broad strokes. So there was at least one reference to an indication that we would have a vaccine mandate for private employers with more than 100 employees. But there was very little detail in September, no indication of how you count 100 employees, no indication of what the testing alternative would look like. And so there has been in the last 2 months lots of speculation about what that standard would entail. Last week, our patience, I won't say paid off, but last week we were gifted a 490-page publication from OSHA that provides, I will say, more detail, but doesn't answer all of the questions, as you'll see when we go through this. So bottom line is at least we have a little bit better idea of where we stand, but there are some unanswered questions that employers still have to deal with. One thing to remember is that this OSHA standard is just one of 4 regulatory buckets out there that apply to employers and vaccine and testing mandates. There are already executive orders and regulations that address access to federal sites, coverage for certain federal contractors and subcontractors, and coverage for healthcare workers at facilities that receive Medicaid and Medicare support. What we are focused on today is the ETS that just came out last week, and the way we're going to break it down is essentially into three big sections. We're going to give you an overview of the basic ETS obligations, including timing, coverage, things like that. And then we're going to get a little bit more into the blocking and tackling of the actual vaccine mandate and the testing alternative. And then finally, we're going to finish up with some tips and traps that we've been analyzing and more accurately wrestling with over the last week since the ETS came out in response to questions that have been raised by some of our clients. So I'm going to flip it to Brian, who's going to take care of the first part on basic obligations, timing, and coverage.
Yeah, thank you, Rod. Good morning, everybody. I'm going to go ahead and kick things off with a high-level overview of the basic ETS obligations. I do mean basic. We're going to get into the weeds on all this in a bit. A discussion about when the requirements go into effect, which we all need to know, and who's exactly covered by the ETS, both employers and employees, because there's a difference. So let's begin with, again, the sources of all this. As Rod mentioned last week, the other shoe did drop, and the federal sort of OSHA ETS standard was issued on Thursday and published on Friday. All of the deadlines we're going to be talking about in a bit cue off of that publication date, so it's that Friday date that matters. And if you're really looking for something to add to your bedtime reading, there's a full copy of the whole 490 pages in the link that we provided. There's also shorter, semi-shorter FAQs that OSHA has provided as well. OSHA also actually did a webinar of their own last week that you can actually view online if you're interested. They also have some other resources that are out there. So feel free to take a look at all that. As for the basic obligations, well, as we'll see, they're not too basic. You know, as Rob mentioned, the overview on in September on the 9th sounded fairly straightforward, but like lots of things, when it comes to actual implementation, the details are extensive. The ETS actually has language and specifics about the development of a policy regarding vaccination and testing, what needs to go in it, particular language for certain sections, things that need to be expressly noted. It has language about notices that have to be provided to employees about the vaccine's efficacy, non-retaliation, and a bunch of other terms, which we'll discuss. It talks about the kind of documentation that's acceptable. It talks about the outlines of the vaccination or the vaccine test program and how that sort of is constructed. It has a lot of language about PTO and paid sick leave and the limitations and obligations that go with it. There are also, surprisingly, obligations related to masking, which are far more expensive than frankly, we expected. Language about reporting on the employee side when they have a COVID positive test or diagnosis. And then they have the flip of that, a language about what you as an employer are obligated to do with respect to OSHA reporting for certain fatalities and inpatient hospitalizations connected to COVID. And then there's other information about the development of a vaccine status roster and reams of other sort of record keeping and access requirements and more and more and more. It's very detailed, and we're going to do our best to hit a lot of it. But those, believe it or not, are the highlights. What's not addressed in it? Well, there's nothing in there about social distancing barriers, ventilation, or contact tracing. Some of the stuff that, frankly, was in the healthcare ETS. That's not in this particular ETS. They could have done it, in theory. Frankly, we've been waiting for maybe 2 years now for more extensive ETSs on this. All we really have are general CDC guidance. But OSHA does note that with respect to that guidance, employers still have general duty clause obligations under OSHA writ large that don't go away, and so they haven't put them in the ETS, but they still are taking the position that nonetheless employers are well advised to follow those guidelines to the best they can. So what are the deadlines? The important things. Well, just in time for the holidays, there are 2 deadlines to keep in mind. The one deadline that's getting the most press is January 4th, and that's the date that you have to have all of your employees, quote, fully vaxxed, which we'll talk about in a bit, or subject to weekly COVID testing. But the important thing to note is that is just one deadline. There's an earlier deadline of December the 5th, and that applies to everything else that we're going to talk about during this webinar. The policy, the notices, the masking, the records access, everything else is covered by December 5, not January 4. And there's actually a pretty good chart that OSHA put out that sort of describes the deadlines. You can link to it. It's sort of a funny chart because the only box that's checked for January 4th is the facts and test box. Everything else looks like a binary chart with X's all over the way down the right side. So it's sort of a useless chart, but it's there if you'd like to look at it. The other thing that's important to note is with respect to the deadlines, these are deadlines that apply to states that are covered by the federal OSHA ETS itself and are covered by OSHA proper. For 28 states out there in the United States, they're not covered by that. They're technically covered by OSHA state plans, where states have adopted as sort of a one-off individual sort of safety and occupational health requirements that are and need to be, quote, at least as effective as the OSHA federal measures. That means that even though these deadlines, January 4th and December 5th, are out there, for those state plan states, if you happen to be in one of those, states still have 30 days to adopt those measures. And when they adopt it, in theory, they can pick different dates. Now, we'll see what they have to do, but for clients and organizations who have multi-jurisdictional, multi-state locations and employees, you may have different phased-in implementation dates, which actually creates a lot of other headaches, which we'll talk about later on in this webinar. The other thing that's important to note as far as deadlines, they moved the vaccination deadline for everyone, and that includes employers who are governed by the Executive Order 14042 for certain federal contractors and subcontractors, and employers who are covered by the CMS healthcare rules. Those had earlier trigger dates, but thankfully they've all moved them back per this ETS and per other administration announcements, and so everybody is now looking, at least on the vaccination side, at a January 4 date. The only exception to that, though, is Executive Order 13991 regarding federal site access. Those rules are already out there. That deadline's already coming up here in November, and that goalpost has not shifted. So here's the big question everyone's asking. So is this really going to happen? Deadlines are great. We get it. But do I really need to scramble for this? And that's a great question. Right now there are 6 federal actions filed as of yesterday against the OSHA ETS in the 5th, 6th, 7th, 8th, and 11th and DC circuits. And then today we found out that there were 3 more suits that have been filed in the 2nd, 4th, and 9th circuits, all of which were filed by unions, by the way, bringing the total number of suits filed up to 9. There's also a nationwide preliminary injunction that was initially granted by the 5th Circuit. That injunction was issued on Saturday. The briefing for that was completed yesterday. In theory, it is ripe for decision. However, you may not know this, but when you have sort of multi-circuit cases like this with suits filed across the U.S., per the procedures, they have the ability to assign that case eventually through a circuit lottery. And so it may start with the 5th Circuit with respect to the injunction, but it may not end there. And these cases may all be consolidated eventually under another circuit or the 5th Circuit, depending on how the lottery results end up. The earliest that can happen is next week on Monday or Tuesday. And so that permanent injunction, if it comes into play, the 5th Circuit can actually rule this week before the lottery, or they can wait until the lottery. We'll just have to see. If they go ahead and issue an injunction this week before the lottery, and then it's assigned to another court that sort of is not too keen on this, you can expect the DOJ to quickly take action to try and dissolve any action that the 5th Circuit takes this week. There's going to be a lot of swirl, frankly, in the next coming days. You're going to have to pay attention to the news on this, but hopefully we'll have more guidance and more definition about true deadlines, maybe as early as the mid part of next week. So, who's covered by all this? Well, quickly, if you're trying to think about sort of general coverage, it covers all private employers, including for-profit and non-for-profit, religious and non-religious organizations. There's some constitutional issues, I would assert, about the latter coverage, but in theory, the ETS covers everybody. With respect to state and local public employers, it only covers some. And this is a quirk about how OSHA is designed. But technically, if you're covered in a state under a state plan for OSHA, then if you're a state or local public employer, you are going to be covered by this ETS. If you're not in a state with a state plan rule, then you're not covered by the OSHA ETS as a state or public employer. Now, that's the way it works for state and local employers. For private employers, again, everybody's in the same box. Everybody's in the same boat. But for local colleges, universities, cities, towns, etc., if they're a public employer, you may have to check more carefully about whether this applies to you. Likewise, there are special rules about employers covered by the Executive Order 14042 for federal contractors and subcontractors and the OSHA Healthcare ETS. The way it works is that with respect to coverage, if you are not at a site that is covered by those special rules, then this OSHA ETS will apply. But for those sites, workplaces, and settings that are covered by the executive order or that are covered by the separate healthcare ETS, then OSHA has said we're not going to double up on you, and for those sites, you can only follow the executive order 14042 or the healthcare ETS. You don't have to sort of layer over top of each other. And that's super important, but it's also complex, and we'll talk about that more in a bit. So who's covered? All private employers, some state and local public employers, and some employers covered by the executive order and the OSHA healthcare ETS, depending on where those sites sit and what they're doing. So, how do you count? Well, that's a big question. We had a lot of debate about this in our earlier webinar that we did almost, goodness now, a month and a half ago, speculating about how they count. But now we know. And what the rules say is you have to have 100 or more employees. We're talking about true employees, not independent contractors, but true employees. But it includes pretty much everybody, part-time and full-time, temporary, seasonal, and regular employees. It includes remote and non-remote, indoor and outdoor, and minors and non-minors. Now we're talking about the count, not the coverage, which we'll get to in a second. But we're talking about who triggers the overall 100 employee count. It's pretty much everybody, and it's also measured across all of your U.S. employer locations. So it's not location specific. It doesn't make a difference if I have 25 people at one location and 30 at another and 30 at another and 10 at another and 10 at another. No, that's not the way it happens. It's all locations get added together for the 100 count, and even if I hit that trigger, even for the smaller locations, they're covered. It sort of covers platform-wide. And that includes people regardless of whether they're vaxxed or not. So it doesn't make any difference if I have people who are fully vaxxed. They're still in this 100 employee count. The other important thing to know is what time do you measure the 100 employees? And again, there are different rules that are out there under different laws for measurement. But don't get confused by that. The way this OSHA ETS works, it's actually fairly simple. You first take a look at the number of employees you have as of November 5. And if it's over 100, bingo, you're covered. And you're not just covered as of that point, but you're covered for the entire ETS duration, which is up to 6 months. Likewise, if you're not covered as of November the 5th, let's say you have 98 people, but then you hire 2 more people, 15 days later, then bingo, you're now covered later as long as the ETS is in effect, and it also applies for the duration of the ETS. The way that means is, what that practically means is, the opposite is also true. If I'm triggered on November the 5th or after, and I have more than 100 employees, and then I later slip down below that number to 96 employees, doesn't make any difference. You don't go in and out of coverage. Once you're triggered for the entire ETS duration. So there are 2 measurement points, right at the beginning, and then if you're not covered then, later on for the entire 6-month period. So you're going to have to keep an eye on it if you happen to be a smaller employer. The other interesting thing about this, and we had a lot of debate about it on our earlier webinar, how are you going to deal with related legal entities? Because technically legal entities, in theory, sort of stand alone for a lot of analyses, and there are all sorts of different tests under the EEOC and under the Department of Labor and under the National Labor Relations Act for how you look at and count and define sort of related legal entities. Interestingly enough, in the ETS, they sort of bury this in the preamble, and they say that related and affiliated legal entities are going to be deemed combined for coverage if they handle, quote, safety matters as one company. The only exception they give to that is if you're in a franchise or franchisee relationship. That's a really odd test, I'll be honest. That is not the, quote, single entity test or single employer test that a lot of people are more used to. It's also not the control test that we're normally used to seeing. Hopefully there'll be more clarification on that point. There is nothing in the FAQs about this, but maybe OSHA will come out with more later. And then who's not counted in this? You don't have to count independent contractors. And if you have temporary workers, not employees, but temporary workers who are assigned to you from the ODECOs of the world or Manpower, and they happen to be working at your site, they do not go into the 100 employee count. They go into the state staffing agency's count, but they don't go into yours. Lastly, before I turn it back over to Rod, that's the threshold. You know, who's counted? Do you have 100 more employees? Am I, as an employer, covered by these rules? That's different from things you might have read about employees that are covered by these rules. And the way it works is technically everyone is covered within your organization, within the U.S., except for employees who work exclusively outdoors. And there's lots of language about what that means in the preamble and in the FAQs. It also does not include people who report to a workplace where other individuals, who do not report to a workplace where other individuals are present. And they give an example of such as coworkers or customers. So basically one person is enough. So you have to be fully remote or sort of living in a bunker somewhere. And then it also doesn't include individuals who are remote, quote, while working from home. But they go on to note that while you have a remote employee at a given point in time who may not be covered for part of their time that they're working remote, to the extent that for a given week they are coming back to the work site, as Micah and Rod will tell you later, they do have to be subject to this OSHA ETS with respect to vaccination and testing. So some remote workers can come in and out of coverage. But keep in mind, this has to do with employees who are covered for parts of which we're going to talk about next. This has nothing to do with the count. The count rules are on the earlier slide. Pretty much everyone's in that count. These exceptions about coverage only deal with individuals for which they might have to be subject to, for example, the masking obligations on a given day, or the testing or vaccination requirements on a given week. It has nothing to do with coverage itself. So with that, I'm going to turn it over to Rod to talk about testing and how to navigate all that. Rod?
All right, thanks, Brian. If you guys weren't depressed enough as it is, I'm going to make it worse. I'm going to walk through the obligations in the order that they appear in the ETS. And the first obligation is that employers must ascertain the vaccination status for each of their employees. And that's whether the employee is vaccinated or not vaccinated. You have to ascertain their status and make a record and keep a record of that status. And it's not just a green light, red light thing. You have to specify in the documentation, and you have to ascertain whether they're fully vaccinated, which is a term of art, or whether they are partially vaccinated, whether they've had maybe 1 out of 2 vaccines, whether they are not vaccinated because of a religious or disability-related accommodation, or whether they're not vaccinated simply because they haven't provided you documentation to support the fact that they're vaccinated. And while this is, this seems like a normal precursor to having to get vaccinations or having to require employees to get vaccinations, it's a little bit more onerous than it might seem at first glance. First of all, the documentation has to be maintained in the form of a roster of all employees with a list and a checkbox next to it that says, I'm vaccinated, this person's vaccinated partially, not fully, or not vaccinated because we don't have their documentation yet. And that roster has to be treated just as any ADA medical record would be. So that means has to be kept confidential, cannot be shown to persons who don't have a need to know about it, must be kept separate from personnel files, all those requirements. And the real tricky part, that's not actually on the slide, is that you have to keep the roster updated, but there is no real guidance on what kind of a time frame you have in which to update it. So if Bob comes in this afternoon and gives you his COVID vaccination, gives you a copy of his vaccination card, how long do you have to input that new information into the roster in order to keep it up to date? There's no real guidance on that in the ETS, but there are, and Mike is going to talk about this, so I don't want to get into it too deeply, there are some very short turnaround times in the ETS about when you have to produce this documentation, either to the employee or to OSHA itself. And when I say very short, I mean end of the next business day or within 4 business hours. So indirectly, that gives us some guidance on the expectations of how up-to-date this living document, this roster, has to be. And that's another one of those little issues that, as Brian mentioned before, it's kind of buried in the preamble and buried in the ETS itself. But this is one of the more burdensome record-keeping requirements, I think, of the whole thing. So what does the documentation have to look like? What is sufficient proof that an employee has received the COVID-19 vaccination? We've had a lot of discussion leading up to this about whether an employee attestation, I'm signing a document that says I got the vaccine, would be sufficient, and in general terms, it's not. There is one narrow exception that I'll talk about, but for the most part, the documentation needs to take the form either of a vaccination card, a CDC vaccination card or printout, or immunization records from some recognized healthcare provider or public health agency, or something along those lines, medical records documenting that the vaccination actually took place. And then finally, there's a bit of a catch-all that talks about any other, quote, official documentation that contains the data that OSHA expects to see. So the attestation in and of itself is not going to be enough. Nor is a showing by the employee of a particular type of documentation. The employer actually has to retain a copy of the documentation that shows that the vaccination took place. So in terms of what it needs to contain, it needs to identify the type of vaccine, what did they get, the date, when did they get it, where did they get it, who was either the doctor or the clinic site that administered the vaccine, and then of course, again, it's not on the slide, but there has to be enough identifiable information on the vaccination record to tie it to the specific employee who's handing it to you. Now, there are a couple of acknowledgments in the ETS that are helpful if you've obtained documentation in the past prior to November 5th, and that documentation happens to be missing one of these data points, that is not fatal, and you don't have to go out and reacquire the documentation. Similarly, if you're relying on state immunization records, some states and some locations have set up temporary vaccination facilities, and so the immunization records might not show where a particular shot was given or received. If that data point is missing, then under the ETS, the documentation is still acceptable. But on a going forward basis, what you obtain should have these data points, and you need to make sure that you retain a copy of it rather than just see it and check it out and check off the box. In terms of maintaining a copy, there is some guidance on what format that has to take. It is fine for it to be an electronic format, so if an employee wants to take a picture of their vaccination card and email it or text it to you as their employer, that's perfectly fine, just has to be legible. Hard copies are also perfectly fine, and this is something that you can spell out in your vaccination policy. Now, there is, as I mentioned, a narrow exception for employees who cannot produce the documentation that the ETS requires. If they have lost or can otherwise not obtain that documentation, if they have made an effort to secure that documentation, in other words, did they go to the health department or the county or an administrator or something like that and try to get a replacement card or try to get a replacement certification and were unsuccessful in that effort, and under those circumstances, they can attest to the fact that they have been vaccinated, either fully or partially. But, and this language appears several times in the ETS, OSHA is specifically requiring that that attestation include penalty of perjury language, which basically says, I understand that if I provide false information, I'm committing perjury, and that's a crime. And that it's a kind of a club. It's a fairly obvious club that they're beating us over the head with, but it's an effort to avoid the people who are just going to show up with a letter that says, yes, I was vaccinated under these circumstances. You have to include the penalty of perjury language to try to deter fraudulent representations in that context. What is not acceptable as proof of vaccination is the fact that you've had an antibody test, the fact that you have had COVID in the past, or the fact that you purport to have some sort of natural immunity to COVID. Also, in terms of incidents where people have brought in documentation and just showed it to their employer without providing a copy of it, that is insufficient, with one exception, and that is if in the past, and by that I mean before November 5th when this came out, if an employee came to you, showed you a copy of their certification on their phone, and you in turn as the employer documented that event, then you don't go back, you don't have to go back and recertify for that individual. So there are a few acknowledgments in here that you've been making efforts. For those people who've been making efforts in the past to get this documentation, you don't have to go back and duplicate most of those past efforts. There are some providers who are providing digitized vaccination records in the form of records that you can scan a QR code on your phone, go to a link on a website, and then see the documentation on the vaccination. The ETS specifically says that it's not sufficient for employers to just keep a copy of the QR code that they may scan later. You have to scan the code, go to the website, get a copy of the documentation, and that is what you have to retain in order to meet these record-keeping requirements. One thing that is worth mentioning is that there's no affirmative duty imposed on employers by the ETS to sniff out fraud. And there's no obligation that you investigate what you perceive to be potentially fraudulent records. But obviously, if there's anything that employers are participating in or OSHA finds that employers are complicit in, then they'll be subject to the same penalties that the employees are for making these false representations. All right. So on to the main thrust of the ETS, and we're 30 minutes in. I know you're wondering why we haven't gotten to this by now, but the preamble was necessary here. Interestingly enough, the way the ETS is written is actually a mandatory vaccination policy requirement, and that theme permeates the document. The goal of this thing is to get people vaccinated, and employers are required to create a mandatory vaccination policy. Employers can be exempted from that requirement only if they adopt a system that allows an employee to either be vaccinated or to be tested, if they require the employee to submit to weekly COVID testing if they're not vaccinated, and if they require the employee to produce a negative test result on a weekly basis if they're not vaccinated, and finally, if they require the employee who is not vaccinated to mask up in the workplace. So it is clearly skewed toward making it as easy as possible for the employee to get a vaccination and as challenging and difficult as possible for the employee to opt for testing. I mean, that's the theme. It's all but admitted in the ETS. And I'll use the word force. I'll change it to the word encourage. But if you read through any part of the ETS, that's the direction that this points in. And that's the thing that you have to keep in mind in terms of analyzing these obligations. So the practical effect here is that you've got three choices as an employer. One, you can implement an across-the-board mandatory vaccination policy that does not have an alternate testing option for all employees. Two, you can implement a vaccination policy across the board for all employees that does offer the alternative of getting a weekly test. Or three, you can mix and match. And I was skimming, while Brian was talking, I was skimming some of the questions that we got, and a couple of you asked this question. You can have different requirements for different employees or different locations. So if you are a retailer, for example, you can require your public-facing employees to comply with a vaccination-only policy. Or at the same time, you can have your back office employees who don't deal with the public have the alternative of vaccination or regular testing. I will give you this caveat. I know, again, Mike is going to talk about it, but all of these three options are subject to the requirement that you account for religious-related and disability-related accommodation requests and exemptions. So what type of vaccine is acceptable? Brian mentioned this. Employees have to be fully vaccinated. That means you've got to have if it's a 2-dose vaccination, you've got to have both doses, and you have to wait for the 2-week period afterwards until you're considered to be fully vaccinated. The ETS recognizes that there are different kinds of acceptable primary doses now. It can either be 2 of one type, like 2 of the Moderna, 1 of the Johnson & Johnson, or an accepted combination of different manufacturers, depending on where we are with that, with the CDC on that. It also includes approved or authorized vaccinations, EUA vaccinations that are approved by the FDA. Also includes those that have been listed for emergency use by the World Health Organization, and then finally those that are administered at a U.S. site as part of a qualified clinical trial. Importantly, at this point, and again, this was another question that some of you have already asked, boosters are not mentioned, not required by this ETS at this time. Now, testing. This is a big issue, because I know a lot of our clients and probably a number of you on the call actually probably went out and started stocking up on home test kits back in September when the path to the pandemic, or path out of the pandemic, sorry, was first announced. For those folks, OSHA has legitimately or literally thrown a wrinkle into the plan, because it's possible that one interpretation of this ETS would make those home test kits far less useful than we originally thought they might be. In defining what an acceptable test is, OSHA says it has to be an FDA-authorized test and administered per the instructions of the test, which is not too difficult. But then the definition goes on to say that it cannot be both self-administered and self-read by the employee unless the employee is observed by the employer or by an authorized telehealth proctor. And this is what essentially creates the mess. I mean, I'll go through the rest of these bullets real quick. And in terms of the types of tests that you can have, it can include NAT tests and antigen tests, which are basically your PCR test, of the most common form of that. It also can include rapid tests. It cannot include antibody tests, and it cannot include the NAT tests because most of them have to be done in a laboratory and they can't be self-administered. But here's the real issue, and it's this last question down here. If you have an employee you've given a take-home test to, let's call him Bob. Bob takes the test home. He's standing in his bathroom. He swabs his nose. He processes the test according to its instructions. He gets a test strip that shows that the test is negative. Can Bob take a picture of that negative test strip and email it to you as his employer? And there is an argument to be made that he cannot, because he is essentially self-administering and self-reading the test. There's nobody there to proctor him. There's nobody there to observe him. And there's language in the ETS that can be interpreted both ways, and frankly, there's no real consensus on the answer to this question yet. The ETS says that the goal is fraud prevention because people have an incentive not to acknowledge that they've tested positive because they may be afraid of losing their job. And so the argument would be that you should let Bob just take a picture of the test strip and send it in. But if the goal is fraud prevention, there's nothing that stops Bob from using a 2-week-old test strip that came up negative. So if this is the requirement, then you've got to have somebody in HR or somebody designated by the employer who can get on a video call with Bob, watch him do the test, watch the test result come out, and acknowledge and document the fact that the test strip was negative. And that is a huge burden on employers. But we don't have an answer on this yet. So it may make it difficult for you to use all those home test kits that folks were stockpiling in anticipation of this thing coming out. 2 slightly positive notes of this. 1, we do expect that there will be more guidance on this issue because of its importance. And 2, as I'll talk about in a minute, there is kind of a good faith effort defense to this with respect to the availability and the use of testing. So keeping the ball rolling here, how often do you have to test? If you have an employee who comes to work at least once a week, you have to test them once a week. That's the short version. And the documentation has to be produced within 7 days of the last result. if you have an employee who comes into the office less frequently than once a week, then, and they just have to come in, to make copies or to do something and physically present in the workplace, then they have to be tested within 7 days before their date of return to work, and they have to provide the documentation upon their return to work. And this is the same time frame, the same window that applies to new employees. So they have to get tested no sooner than 7 days before they're supposed to show up at work, and they have to produce the test result when they show up at work. And if you think about it, this is a fairly narrow window. I mean, especially if you're using a PCR test or sending it off to a lab somewhere that's going to take you 2 or 3 days to get results, you've got a 7-day window in which you have to complete the test, send it off, get the results, and then he or she shows up at work and has to have the test results in hand. There's no testing requirement for full-time, fully remote individuals, employees. There's also no testing requirement for individuals who have had a positive test or a COVID diagnosis, because there's a significant risk there of false positives. And finally, there is a requirement that if somebody does test positive, they need to be pulled out of the workplace until a negative test is provided and they otherwise meet the CDC return to work protocol. And then last, again, talking about testing availability, to directly quote the ETS, OSHA thinks that current test availability is sufficient to meet the increased testing demands. I don't know where this magical warehouse is with all of the compliant tests, but if anybody on the call does, please feel free to shoot us an email and let us know. I don't know the basis for this conclusion, but I know we've got a number of clients that we've spoken with who are having a hard time obtaining tests. And then finally, this is the good faith defense. And the key language is OSHA will look at efforts made by the employer, look at the pattern and practice of testing, and consider refraining from enforcement where there is evidence of good faith. Words like look at, consider, and refraining are the ones that give me the least amount of comfort in this good faith defense, but it is there. And it's really focused on your ability to show, hey, I went out, I looked for tests, I searched, or I'm in a rural area where tests are not available. And if that's your situation, then you should begin documenting the difficulty of obtaining those tests now. I can't be sure that this good faith defense would apply to the situation that I described earlier of Bob in his bathroom, but at some point, I know there are folks who are just not going to be able to devote the resources to having a full-time HR person or somebody else who's designated to just receive employee phone calls and watch them swab their nose in their house. So this may be an avenue that we can pursue depending on the specific situation. But like I said, the language of the good faith defense doesn't give me a whole lot of comfort, but it is a tool in the toolbox. So I promise to depress everybody a little bit more than they already were, and I'm pretty sure I've succeeded on that front. So maybe Micah can cheer us all up a little bit.
Thank you, Rod. I'll do my best. Good afternoon, everyone. This is Micah. I'm going to be talking with you today about the masking, leave, reporting, and record-keeping obligations of the rules. So obviously, it's the vaccine and testing components that have gotten the most publicity. But there's more in here than I think we at least expected in terms of masking requirements for unvaccinated employees. So let's start with that one. To be clear, we're talking here only about employees who aren't vaccinated. If an employee isn't vaccinated, then they are required to wear a mask in the workplace, as long as they are indoors or, and this is the language of the rule here, occupying a vehicle with another person for work purposes. I think just means in a car with somebody. So if an employee is unvaccinated and working indoors or in a car, then they need to wear a mask. There are some exceptions. First, if an employee is alone in a room with floor-to-ceiling walls and a closed door, they can take their mask off. But no, that's not going to apply to an employee who's, say, working on a factory line or even one who's working in a cubicle. That employee is going to be expected to continue wearing a mask. There's also exceptions for when an employee is eating or drinking for a limited time. That's the language in the rule. Another exception for identification purposes. So, for instance, if you have employees who go through a security checkpoint on their way into work and it's impossible to do the security check if the employee is wearing a mask, the employee can take their mask off, again, for a limited purpose at that time. And then also if the use of the mask would be infeasible or if it creates a greater hazard than wearing a mask. These are common defenses that employers use in OSHA litigation. If a rule is impossible to follow or would create a greater hazard, then obviously it would be illogical to follow it. In this case, OSHA has actually made these defenses explicit in the rule. If an employee can't wear a mask because it would be unhealthy, because of, say, asthma or something like that, or if it would be infeasible, an employee doesn't have to wear a mask in that circumstance. There are a lot of state and local mask rules now, so it's worth noting this one is going to trump those, at least in the workplace. So if there is a state workplace rule about masking, this is going to preempt it. There may be litigation about this, but this is where federal preemption matters, and we would expect that this rule would preempt the state or local rules. On the other hand, if there's a state or local rule that is more generally applicable, for instance, if a state law requires masking in all indoor places and doesn't include the exceptions that I listed above, then employees would still be required to follow that rule because it's more restrictive, more inclusive than the OSHA rule. There are exceptions to the vaccine requirement, the testing requirement, the masking requirement. First of all, there's the coverage exclusions that we already discussed. So if an employee is working entirely from home, entirely outdoors. Also, if a workplace is covered by the Safer Federal Workforce Executive Order 14042 or the Healthcare Emergency Temporary Standard, which was issued this past summer, those rules are going to apply, not the ones we're talking about now. Also, if an employee has a medical or religious reason, that can be a basis for not, again, being vaccinated or getting weekly testing or having to wear a mask. I should say that these aren't new rules. They're not stated as regulations in the new rule. They are instead existing requirements under the federal employment discrimination statutes, in particular the ADA and Title VII of the Civil Rights Act. And they are saluted to by OSHA in this rule. Employees are allowed to ask for exceptions for these reasons. And you might say that the rule creates a implicit, kind of embedded, expected accommodation for an employee who can't get vaccinated because they have a religious or medical reason, and that's that they will be tested instead on a weekly basis. But an employee can ask for an accommodation even to the testing requirement and also to the masking requirement that employers are going to have to process. And there is a saving grace to these, which is that an employer isn't required to provide an accommodation if to do so would cause an undue hardship, or in the case of a medical reason, if there's a direct threat. And an employer might be able to argue that an employee coming to a workplace unvaccinated, unmasked, untested creates an undue hardship. So there are still going to be issues on a case-by-case basis about whether or not any given employee is entitled to an accommodation, and we would encourage you to do an interactive process with every single one of them as required by these statutes to determine if in fact an exception is necessary. There are also leave and paid leave requirements in the rules. So talking first about time off for vaccinations. I'm going to talk in a minute about time off if an employee gets sick because of a vaccination, but that's handled a little bit differently. So first, if an employee is going to get vaccinated, an employer is expected to give them a reasonable amount of time and at least 4 hours per dose of paid time. So there may actually be circumstances in which it's very hard for an employee to get a vaccine where they have to be given more than 4 hours of leave, but under the rules, they have to be given at least 4 hours of paid leave in order to get the shot. And that's 4 hours for each dose. So for the two-shot vaccines, that means twice. For the one-shot vaccines, that means only once. It should be noted that OSHA says here that this 4-hour rule is the cap, but acknowledges that there may be other laws that require additional pay or pay for longer periods of time. For instance, if it takes an employee more than 4 hours to get the vaccine. They could be referring to state law, but they might even be referring to other federal laws that are enforced by, for instance, the Wage and Hour Division just down the hall at the Department of Labor. So we think a fine reading of the rule is necessary here. This rule itself doesn't require more than 4 hours of pay for each dose, but other state or federal laws may, and that's an analysis that you would need to do. The rule also addresses whether or not an employer can require employees to take sick leave to get the vaccine, to account for this pay. The answer there is no, but it's a little bit different when it comes to time off for side effects from receiving the vaccine. The rule says that employers have to give employees a reasonable amount of time to recuperate after getting the vaccine if they have side effects. The rule itself doesn't say how long, but guidance provided by OSHA at the same time as issuing this rule has said that 2 days is to be expected, meaning you don't have to give more than 2 days of sick time for employees. That's something like a cap. It's you're at least presumed to be compliant with this rule if you give employees 2 days of sick leave if they have side effects. And if there's worse cases, if somebody has, side effects that last for weeks on end, that's not necessarily going to be a problem for the employer. The employer is expected to provide at least 2 days. In this case, you can require an employee to take sick time to pay for this time off, if you, in fact, provide employees with a separate bank of sick time, or if you have just one bank and it's all PTO. If you have two banks and one is for sick time and the other is for vacation time, you can't require employees to take their vacation time to deal with side effects from receiving the vaccine. All right, employee reporting and removal obligations. So OSHA rules are written to govern employers, not employees. But one thing OSHA wants is for employees to be telling employers when they're COVID positive. And so what OSHA's done here is told employers that they have to create their own rules that will require employees to tell them when they are in fact COVID positive or have a COVID diagnosis. They're expected to do so as soon as practicable if they're not at work. And if an employee finds out that they are COVID positive while they're at work, they're supposed to tell employers as soon as safely possible. So in other words, if an employee finds out that they're COVID positive, they don't need to run into the middle of the group meeting to tell everybody. That wouldn't be very safe. They can instead wait safely on the side until the meeting's over and are expected to tell employers as soon as it is safe. If an employee is COVID positive, they have to be removed from the workplace. As Rod described earlier, they are expected to follow CDC quarantine expectations and receive a negative test before returning to work. Employers don't have to provide paid time off in these instances, and they can require employees to work as long as they're not too sick to do so. I'll go through these last couple slides pretty quickly because we want to get to some of the tips and traps that we intend to talk about at the end. There are also COVID reporting obligations to OSHA here. So I'm not talking about recording obligations, meaning recording of COVID illnesses in injury and illness logs. That's already required. There are rules about reporting to OSHA when an employee either dies because of COVID or is hospitalized. We are expected to tell OSHA in these circumstances in 8 hours in the case of an employee fatality, in 24 hours in the case of an inpatient hospitalization. The clock starts from the time that we know about it, meaning when we know about the fatality or the inpatient hospitalization. There's still a difficult question here about, well, what if it takes us longer to determine if they are work-related or not? We usually know if an employee has COVID before they're hospitalized, and we can likely discern pretty quickly if that's what they died from as well. Whether or not they got it at work is often a more complicated question that I don't think we really have time for now, but I think there remains a question about whether we can take more time to try to answer those questions, because that often isn't something that we could discern within 8 hours. If you have questions about that, please call us and we can talk more about it. There are record retention and access requirements in the rule as well. So employees are allowed to access their own testing and vaccine records. They're not allowed to access the records of other employees. They are allowed to ask for aggregate data, meaning, please tell me, employer, how many employees are in my workplace and how many of them are vaccinated. There's no limit, interestingly, to how often they could do that. I mean, theoretically, an employee can ask every day. OSHA envisions employees playing an active part in the safety program, and this is kind of like a FOIA within the workplace. OSHA gives employees the opportunity to request this information so they can make sure that their employer is following the rules. Finally, if during an inspection OSHA asks for any of these kinds of documents, the policy, the roster, the aggregate numbers, an employer is expected to provide it in 4 business hours. And yes, you heard that right. It is a matter of hours and business hours. So that's different than the reporting obligations, which are straight hours. The document production are business hours. In our experience, as long as you're moving promptly, OSHA is usually pretty understanding, but I have seen employers get cited because they turned around this kind of data too quickly. So you want to make sure it's easily available so you can produce it to OSHA in the case of an inspection. There's not a straight training obligation within the rule, but there is we'll call it an education requirement to explain to employees about the benefits of the vaccine. And the CDC also has materials that employers can provide to employees to satisfy this obligation. All right, with that, I'm going to pass it on to Brian. In these last couple minutes, we'll talk about some tips we have and some traps to avoid.
Yeah, thank you, Micah. With respect to tips, just one high-level item about coverage that I think is worth noting. As we mentioned earlier, there is a macro exclusion with respect to Executive Order 14042 for certain federal contractors and subcontractors and individuals who are covered by the separate OSHA healthcare ETS. But it's helpful to keep in mind, those programs are triggered and based off of locations. The way the executive order works, it applies to certain workplaces for employees who are working, quote, on or in connection with a covered contract, or employees who are likely to come into contact with such employees at such a working location. So even if you're not working on the contract, you might bump into somebody who is, well then bingo, that workplace is covered. Likewise, the ETS, with respect to the healthcare ETS, deals with certain settings that are defined in that healthcare ETS. So the trap is you got to be careful what you read. When you read the initial administration summaries about this and even some press briefings, it implied that, well, if you're covered by this executive order, or you're covered by this separate ETS that's been put out in June for the healthcare, you don't have to worry about all this. And that's not true. That exclusion only applies for the workplaces, for those settings. It does not apply employer-wide, company-wide. And they even give an example of this in the ETS about a pharmacy chain that operates ambulatory care clinics embedded in their stores. The people who work within those ACCs would be exempted from the ETS, but everybody else in the store and other parts of the company would, in theory, be covered by the ETS. And that's a pretty good example. The only reason we raise that is it's more complex. You're going to have to do a drill down about sort of who's covered by what. Likewise, that's going to create some morale issues when you're developing policies. If you have one policy, for example, that covers PTO and sick leave for some but not others, that might be a hard sell. Likewise, as a practical matter, we're advising clients you're going to need 2 policies for these circumstances. One policy, in theory, that deals with the ETS rules and all the sort of bells and whistles that go along with that, and one policy that, in theory, for example, only covers the executive order. So you just need to think about that when you're designing how to implement this. Well, Rod, back to you.
All right, thanks. Continuing on with the theme of be careful with what you read, one of the major issues that we've anticipated is the notion of who has to pay for the cost of testing. And frankly, OSHA punted on this issue, despite the fact that a lot of what you've seen in the press indicates that the ETS allows employers to pass the cost of testing on to employees. But what the language actually says is that the ETS itself does not require employers to pay for testing costs. And then it goes on to say, but other laws might. Well, no kidding. We knew that there were other laws that potentially implicated this cost shifting before the ETS came out, so this doesn't do anything to clarify it or set any kind of national standard that employers can actually rely on. Under the FLSA, there are certainly implications, even for exempt employees, if you start deducting from their weekly salary, that you may get arguments that you're no longer paying them on a salaried basis. If, as Micah suggested, you are using testing as a potential accommodation for people who don't want to get get vaccinated, then the ADA suggests that or the EEOC at least takes the position that employers have to shoulder the burden, the financial burden of the accommodation. And then there are a host of state laws that are implicated here, such as laws that deal with necessary business expenses and employers not being allowed to transfer the cost of those necessary business expenses to employees. And then there's another category of laws, like the state laws that the final permanent standard that we have in Virginia, that just outright says you can't force an employee to shoulder the cost of a COVID test if it relates to returning to work. So the ETS did nothing to clarify, and it explicitly says it doesn't preempt any of these state laws. All it says is we're not going to mandate that employers pay the cost of testing in this ETS. So to Brian's point, be careful what you read. And again, following up on another point Brian made just now, and that is we may end up with, like we have for a number of employers who have multi-state facilities, you may end up with a policy that has multiple permutations or addenda depending on what states you're operating in that are specific to those states. We are at time. Brian, I don't know if you want to wrap up or try to knock out a couple more of these, but I'll flip it back to you at this point.
Yeah, thanks. And we are out of time, but let me just highlight a couple of items very quickly. Speaking of time, you'll see in the materials there is another trap to all this. Separate from cost, there are separate rules about time. Just because you may think you're not required to pay for the cost, which I think is sort of questionable to begin with. That has nothing to do with hours worked rules under the FLSA or otherwise for non-exempt personnel's time in doing masking and testing and reporting and swabbing and you name it. And so you need to be careful about that. Frankly, we think, and we've been telling our clients all along, that's where the litigation is going to be. Litigation about accommodations, it's not too sexy, and it's hard to bring a class claim on that. Litigation, frankly, on wage and hour, boy, that's where the dollars are. And you need to think about that when you're developing your policies. Likewise, when you're thinking about your policies, Micah mentioned before, disability and religious accommodation processes and forms. We're helping all sorts of different clients think through this and customize them, but they come in different flavors. And you need to think long and hard about how strict you're going to be about that. There is a little bit of a safety valve for religious and disability accommodations, and some of our clients, frankly, are not looking too hard at the accommodations that cross their desk. If it says religion and it's written in crayon, then bingo, for some clients, it's accepted. You need to think through all that. There are all sorts of strategic pros and cons to that. We can help you with it, but don't think there's one size fits all. The ETS doesn't help you on that. There is some EEOC guidance on it, but you need to look at that guidance carefully. There's some tricks to it, and you need to probably think through your obligations. Likewise, speaking of tricks, a lot of people have said, well, what about state laws that I'm stuck in? I'm in Texas, or I'm in Montana, or I'm in Tennessee, and we've got anti-vax, anti-mask executive orders that I've got to worry about. And that's true. You definitely need to keep that in mind. And luckily, and arguably, the executive order here, the ETS, preempts all this. This OSHA ETS supersedes any kind of state law obligations, but be careful. It only supersedes things to a limit. So, for example, if you're relying on Executive Order 14042, for example, in order to mandate vaccinations, it only exempts state anti-vax laws, et cetera, with respect to covered locations and covered employees. To the extent that you're over-aggressive and roping people into that coverage, then they can still argue, no, that doesn't apply to me. You overshot the bow, and I'm still protected by Texas law, Montana law, et cetera. The other thing is, be careful about the timing. The ETS is not in effect yet. It's ineffective inarguably now when it was issued, even though the deadlines for certain things are going to happen later. But keep in mind, it's been stayed, so it hasn't truly been in effect sitting here today. So if you try and run ahead of your headlights and implement a policy that has certain deadlines, et cetera, before that stay is lifted, then arguably in those states like Texas, Montana, et cetera, you could be challenged about that as well. So be careful. It can be a treacherous legal world out there. So we know we're out of time, and we have thrown a ton at you. For those of you who are still on this WebEx and have not already hit the bar, thank you for sticking around with us. We know this information, frankly, is a lot, and it can feel overwhelming. But we're here to help. We've got some FAQs that Rod mentioned earlier that we're going to actually publish tomorrow that provide some additional insight addition to this deck itself. OSHA itself has published FAQs, which are helpful. You ought to take a look at that. And we're hoping they're going to supplement that over the coming days. And when they do that, we'll publish information about that as well. And certainly feel free to call Rod, Micah, myself, or anybody else here at McGuireWoods who are your regular contact. We're all part of a larger COVID-19 response team. You can find information about that on our website. We are more than happy to help you as best we can. But we hope this information has been helpful. We thank you for joining, and hang in there. We'll all get through this together. Take care.